So let's talk about how you can assess if your mom is on her way to developing type 2 diabetes. Now, if you're anything like me, you're close to your mom, you want to make sure that your mom lives forever or as long as forever could be, but you also want to make sure that she gets there without having any chronic disease like type 2 diabetes. So in this video, we're going to talk about how you can assess if your mom is on her way to develop type 2 diabetes by looking at her hemoglobin A1c test results. So we're going to go over what is a hemoglobin A1c, what do the test results actually mean, where to locate your mom's A1c test results, and what to do if your mom's doctor doesn't want to run an A1c test. So let's start by talking about what is a hemoglobin A1c test. Well, it's a blood test that most doctors use to diagnose or assess blood sugar levels. This test is usually the one that is run to diagnose prediabetes or type 2 diabetes. Now, specifically with the hemoglobin A1c test, it's looking at in the past 3 months, what percentage of your red blood cells have glucose or blood sugar attached. So let's say your mom has an A1c of 7%. This means that 7% of her red blood cells have glucose or blood sugar attached. And this matters because the higher percentage of red blood cells that have glucose or sugar attached, the higher risk of developing type 2 diabetes or of developing the complications of type 2 diabetes. So it really, really matters. It's also important to know that it gives us an insight into the last 3 months, which means that every 3 months is going to change, but also that it gives us the insight in the last 3 months. So even if your mom, ate really well the day before, it's not going to reflect on the A1c. So it is giving us an accurate kind of picture of what's going on. Because if your mom's anything like my mom, she's just telling me everything that she's doing well, and not the things that we can improve. So it's kind of a good check. Now let's talk about what do the results actually mean in terms of the different categories or ranges of blood sugar. So your mom's either going to fall into normal blood sugar, prediabetes, or type 2 diabetes. So an A1c of 5.6% or less is considered normal blood sugar. An A1c of 5.7 to 6.4 is considered prediabetes, and an A1c of 6.5 or higher is considered type 2 diabetes. So just a reminder though, I am a dietitian, I'm not a medical doctor. So if you're looking at your mom's labs and you want to confirm a diagnosis of prediabetes or type 2 diabetes, definitely chat with your mom's doctor to be able to confirm that. But at least you now know the different categories. We can all look at a number and kind of see where, our parents fall in terms of their A1c and blood sugar levels. So those are the 3 categories. Again, it's important to remember that A1c changes every 3 months. So if your mom wants to implement any lifestyle or dietary changes to be able to improve her A1c or get out of prediabetes, she's able to do that because those numbers are going to change. The A1c is not permanent, which is also really nice to know, because sometimes I know my mom kind of freaks out about her A1c and thinks that she's going to be destined to develop type 2 diabetes. That's not the case. If you want to change things, for the most part, you can definitely, change them in reverse prediabetes or lower the A1c, which means the exact same thing. Now let's jump into where can you locate your mom's A1c. So you basically just want to ask your mom, hey mom, when's the last time you went to the doctors and you had a blood draw, and where are those results? Sometimes your mom's going to know exactly where they are. Most of the time, if she's anything like my mom's in her 60s, she goes to the doctor and kind of, I don't know, just it's the lingo of the doctors. Sometimes it's a lot and my mom doesn't really remember. So you kind of have to dig in and look at medical records sometimes, or if they have online portals, you can also download the test results there. But once you get a hold of the test results, let me show you where you can find the lab. So it's basically going to be titled hemoglobin A1c with EAG or hemoglobin A1c. And you're always going to see a category of results here, and you're going to get your number. So these are my mom's test results. So at this point in time, her A1c was 5.6. which is good. We keep struggling with her bouncing from 5.6 to 5.7. So I'm working with her on that. But right now it's 5.6, which is considered normal blood sugar. And sometimes these test results are going to, give you the ranges. So you kind of have those numbers there to be able to see where your mom falls into. So that's going to be, the best place to look at your mom's A1c test results. Now, let's say that your mom doesn't have an A1c test result, or let's say that it's more than 6 months old, which if it's about a year old or like 2 years old, it's good to know as a baseline. Like you want to know where your mom was in 2020 or 2021 or, or last year, 2022. But ideally you want to have a more recent one. 3 months would be ideal. 6 months is good. More than that, it's good to kind of know where they were at. But again, it's better to have a more recent one. So what's really cool is that if you can go to your doctor, of course, you can go to your mom's doctor and ask for an A1c test. And if they run it, they order it, great, amazing. If for whatever reason your mom's doctor doesn't think that ordering an A1c test is appropriate or necessary, but you and your mom really want to know oh, what's your A1c? What's your A1c? Because we want to know your risk profile. We want to work on things. Then what's really cool is that you can order some of these medical tests like an A1c direct from, different companies. So I'm going to share 2 of the companies that I like to order labs from. I do have to be responsible and tell you that if you are running labs on your own, it's always a really good idea to share them with your medical doctor. Our doctors are supposed to be our partners in health, and it's always a really good idea to just keep them updated on how you're doing or if anything shows up, because they would know what to do if you need further testing for anything. So even though you can order them on your own, just share it with your doctor to be safe. Okay, so the first place that I like to order from is called Direct Labs. So with Direct Labs, you can order your own test. You create your account. It's free to create an account, and then you can order a test here. So basically on the search box, you want to just type in A1c, and the A1c test is on the second page. So you go here, and here's a test, hemoglobin A1c with EAG. You add to cart, check out, all that stuff you guys know how to do. But when you order this test, you're going to get a requisition form, and you basically go to a Quest Diagnostics. You follow the directions. Go to Quest Diagnostics, they do the blood draw, and then you'll get your test results just the same way that you get them at your doctor's medical office. Okay, so that's one spot. The other spot I like to use is Quest Diagnostics. So with Quest, this is their, web page you're going to see when you go onto Quest. You want to go to Patients, Get Tested, and go to Buy Your Own Lab Test online. Shop now, and on this web page on the search box, just put A1c. You're going to see all these tests come up, but it's this one here, the hemoglobin A1c. It's about $45. This one is, direct with Quest. They are going to give you a requisition form. You just go to any Quest Diagnostics. And this video is going on YouTube, so I don't know what state you are in, but I did look it up, and Quest Diagnostics is nationwide. So, if you're in Texas or Florida or whatever, hopefully there's a Quest Diagnostics near you. You can order this test on your own for your mom. So I hope this information was helpful. I mean, I've been helping my mom for the past 2 years and trying to get her to normalize her blood sugar. But the biggest thing is just assessing what your parents or your mom's risk is in developing type 2 diabetes. And you start by looking at the hemoglobin A1c. So I hope this video was helpful in helping you keep your mama healthy.